Hello, everybody, and welcome to this webinar on vaping and oral health, where we'll talk about what dental professionals should know about vaping and e-cigarette use. My name is Annie Kropik, and I am the program manager here at Twin Cities Medical Society, where we do a lot of work to educate healthcare professionals, including dental professionals, about the health impacts of vaping. Today, I'll be talking about the first few sections, and then I'm joined by Dr. Pete Donnell, who is our medical director, and we'll be talking a bit more. So just an outline of what we'll discuss today. The first thing we're going to do is talk about kind of the basics of e-cigarettes and vaping and some trends in use, just to get you kind of everyone on the same page and ready to talk about them. Then Dr. Donnell will talk about both the oral and medical health risks that are associated with vaping and nicotine, and we'll provide you with some strategies so you can discuss e-cigarette use with your clients and patients in your clinic. And so the first thing we're going to talk about is the landscape of vaping, so kind of what's happening in Minnesota right now. Early on when e-cigarettes were first introduced, I think there was a question about if e-cigarettes were going to be a really helpful tool for adults who wanted to quit smoking, or if they were going to be something that lured youth into nicotine use. And what we've really seen is that while some adults vape, there are much higher use rates of e-cigarettes, which we also call vaping, among youth and young adults. So we see now that almost 20% of high school youth report vaping. In fact, that number might be a little low. We actually hear kind of anecdotal reports that it's even higher than that. Almost 22% of those young adults are vaping, and only 6% of all other adults are vaping. So we really see that this trend is concentrated among young people, which is very alarming. When we do look at adults, though, there are some interesting trends to consider. So among adults who use e-cigarettes, 19% of them are former smokers. So these are people who either used to smoke and then now only use e-cigarettes. These could also be people who used to smoke, had quit smoking entirely, and are reintroduced to nicotine addiction through e-cigarettes and vaping. So it can kind of go both ways. But the vast majority of people who are vaping are what we call never smokers. So people who've never smoked a combustible cigarette in their life, but do vape. And this is more evidence of seeing that this idea that vaping is luring young people into nicotine use and into addiction is what's happening. So even though we hear a lot of talk about kind of older folks thinking about quitting with it, these numbers really show us that it's those young people who are using it, and also a significant amount of what we call current smokers. So these are people who use e-cigarettes and combustible cigarettes. Some people will use e-cigarettes maybe in their car, but they'll smoke outside, or maybe when it's a cold day, they'll be vaping because they don't want to go outside. So we see a lot of overlap as well, which can be concerning because we have some evidence that can increase health risks. This is a great graphic just to show the popularity of e-cigarettes compared to other tobacco products among our high schoolers. So you can see e-cigarettes are now twice as popular as cigarettes among young people. They are the most commonly used form of tobacco among young people now. It's happened very quickly and is growing very rapidly. We also see this idea of dual use happening among young people. So 60% of high schoolers who vape use both e-cigarettes and conventional tobacco, which is both cigarettes, things like cigars, hookah, other kind of that tobacco that you're burning. We see a lot of overlap between this, and that lots of young people are using both products. And then nicotine is not the only thing that you can vape, and so we also see a large amount of high schoolers that are both vaping nicotine and vaping cannabis at other times. So a lot of overlap in this substance use. But the bottom line is that what we're seeing with vaping is that we are seeing a whole new generation of tobacco users who are being lured in. Oftentimes, young people are vaping who are people who 10 years ago we think probably never would have used tobacco. They're typically considered lower risk teens. They have a lot of protective factors in their lives. And 10 years ago, they probably would have never thought about touching a cigarette. But e-cigarettes are cool, they're appealing. Lots of young people think, oh, they're harmless, they're no big deal. And because of that, we're seeing a whole new generation getting hooked on nicotine through e-cigarettes. So how did we get here? How did we get to this point where over 20% of our high schoolers are vaping? Before we dive into that, I think it's important for everyone to understand how e-cigarettes work, what they look like, so you feel confident when you go to talk to your patients about them. So all e-cigarettes have a battery. This battery could either be rechargeable if it's an e-cigarette that's rechargeable, refillable, that you use over a long period of time, or it could be disposable if you have a disposable e-cigarette. But you have that battery that provides the power to the whole system. Some e-cigarettes have a button. Many others just turn on automatically when you inhale, so they sense that and turn on. And when the battery turns on, what happens is up on top you'll see that there's a chamber for liquid nicotine. And that's filled with liquid nicotine, and when the battery turns on, the heating element in there heats up, which heats up the nicotine in that chamber, and that aerosolizes into that aerosol that then users inhale through the mouthpiece. So even though e-cigarettes look really different sometimes, which we'll see on the next slide, they all work in fundamentally the same way. But e-cigarettes will look really different now, and they're rapidly evolving. So you can see on the left-hand side on the top, there are some things that look like cigarettes. These are called cigalikes, and these were some of the first e-cigarettes to come on the market. Unfortunately, well, interestingly, these weren't really good at delivering nicotine. And so early on, when you had adult smokers who were thinking about using these maybe to quit or to switch over, they weren't really good at giving nicotine, and so people didn't love them oftentimes. After that, we saw things like vape pens and mods, which are on the left side. That red one is kind of a vape pen. That big black one, they're kind of boxy. We might call a mod. These came on the scene. So these are refillable. You can choose your flavor. You can choose the nicotine strength. You can kind of mix together different flavors to create your own concoctions. And they also heat things to a higher degree than those older first e-cigarettes, which gave a better nicotine delivery to folks. And they started to like those more. But if you've ever seen those in person, they're kind of heavy. A lot of them are big and boxy. You've got to twist off the top and refill them. They aren't necessarily the easiest to use, which is why when Juul came on the scene, which you can see on the top right, it really changed the game. So Juul is small. It fits in the palm of your hand. You can charge it off a little dock that plugs into your laptop. And it's the most popular e-cigarette by far. So it makes up over 70% of the market now. A lot of the growth that we've seen in youth vaping is actually fueled by Juul. And we'll talk a little bit more about the ramifications it's had, but it's certainly the most popular one now. On the bottom are two other e-cigarette examples, both of which are pretty small. They, again, fit in your hand, but you can see how it might be difficult for a parent or a teacher to understand what e-cigarettes look like, because this looks or some other tech device. And so I mentioned that in addition to the e-cigarette device, you fill it up with this liquid nicotine. And so this is often called e-juice or liquid nicotine, things like that. And what you'll hear from a lot of people when they talk about vaping is like, oh, it's just water vapor. But that's not true. So this liquid nicotine that's then being heated up into the aerosol that you're inhaling is made up of propylene glycol, vegetable glycerin, flavoring chemicals, and then nicotine that's extracted from a tobacco plant. And so we get asked a lot, do all vapes have nicotine in them? There are some vapes that don't have nicotine. But what we've seen is that the vast majority do. So over 99% of the e-liquids sold in the United States have nicotine in them. We've also had some studies that show that young people, when they're caught vaping in school, there's some confidential studies that ask them, well, how much nicotine is in here? And a lot of young people will say, oh, no, none. And then when you go and you actually test that in a lab, it has a really high amount of nicotine in it. So when a young person in particular tells you that there's no nicotine in their vape, I think that that's something to be skeptical of and to dig into more, because it's very rare to see no nicotine vapes. And these e-liquids and vapes come in almost every flavor you can imagine. So you can see here peachy rings like candy, ice cream, vanilla, berry, menthol, all sorts of flavors. And these, one thing we know, are very appealing to youth. Youth are much more motivated by flavors and use them more frequently than adults. And the other thing that we see is that these flavoring chemicals may actually cause health problems themselves. And so one example is a chemical diacetyl. It's a chemical that has a buttery flavoring, and so a lot of times it's in flavors like creme brulee or ice cream, apple pie, those sorts of things. And it's associated with something we call popcorn lung. Some of you might remember that previously this was a chemical we used to give the buttery flavoring to microwave popcorn. But when factory workers were in the factory, they started to get a lung disease called bronchiolitis obliterans, which is a devastating and irreversible lung disease. And what we found out is that it was actually caused by diacetyl that was being heated up and inhaled in the factory. And despite the fact that we know that it causes this irreversible lung damage, vaping companies have continued to use it in their products, especially early on, as a flavoring compound. And so there are thousands of flavors out there in different chemicals, and we just don't know yet what all of them will do. But these aren't chemicals, likely many of them, that are safe to heat up and inhale. And then finally, just a word on Juul. Juul is by far the most popular e-cigarette, and that's for a few reasons. One is that it's really sleek and trendy and easy to use, which people, and especially young people, really like. The other thing about Juul is that the makers of it discovered a new way to extract nicotine from the tobacco plant. And the new way that they're extracting nicotine is different than older versions. So with older versions of e-cigarettes, if you had too hot of an e-cigarette, if you heated it to too high of a temp, or if you inhaled a lot of it, it would start to hurt your throat. And so there was kind of, your body gave you this natural feedback of like, this doesn't feel good, maybe we shouldn't have as much. With Juul's new nicotine, which are called nicotine salts, that doesn't happen. You can vape and vape and vape huge amounts of Juul without ever having this uncomfortable feeling you had before. And so this makes it much easier for both adults, but particularly young people, to be exposed to huge amounts of nicotine. We hear of young people doing something called the Juul Pod Challenge, where they see how long it takes them to vape an entire pod of Juul. That's kind of what the little capsules that have the liquid nicotine are called. And the amount of nicotine in a Juul pod is about equivalent to 20 cigarettes. So that's often a young person getting the same nicotine as a whole pack of cigarettes in 10 minutes as, you know, a fun challenge that they do. So really concerning that we're seeing young people getting addicted very quickly through this. And then the other thing to note is that Juul has a really aggressive public relations campaign. You might hear them on the radio, see them in the newspaper. But they recently teamed up with Altria, which you might know is Philip Morris, Philip Morris has a 35% stake in Juul. So even though Juul is very much marketing itself to think, oh, we're different, we're new, we just want to help people stop smoking, even though you may hear that, the fact that they've teamed up with Big Tobacco is concerning, because we certainly know Big Tobacco's track record around targeting kids. The other thing about Juul is that we know that the more nicotine a young person is vaping, if you follow up with them a year later, the more likely they are to continue to have high frequency and intensity, both of vaping and of smoking combustible cigarettes. So really concerning to see that young people are getting huge amounts of nicotine with Juul, about what this is going to mean, not just for future vaping rates, but also for future smoking. And then finally, before I hand this off to Dr. Janelle, one thing that is important to mention is that unfortunately there aren't a lot of meaningful regulations around e-cigarettes right now. So at a national level, there's some regulations. E-cigarettes now have to have warnings that say this product contains nicotine. Across the United States, you now have to be 18 to buy these products. But in terms of regulating what ingredients are in them, what health effects they are, how they can be marketed or sold online, at this point in kind of mid-2019, we really don't have any of that meaningful regulation. So it's really hard for anybody to know what's in their e-cigarette if they're vaping it, and there aren't the controls in place we'd like to see to prevent young people from vaping. And with that, I'm going to hand it over to Dr. Janelle, who's going to talk with you for a while about the health risks of nicotine and of vaping.
Thank you, Annie. My goal here is that everyone who is listening to this webinar has a renewed appreciation for the health risks both nicotine specifically and smoking, as well as now vaping in general, just because this is such a big health issue for all of your patients that you will see on a day-to-day basis. The trouble with nicotine is that it's probably perfectly positioned to create an addiction in people who use it. And the younger you are when you start using it, the more likely you are to develop a lifelong addiction to it. And what I mean by that is that the brain naturally has nicotinic receptors in it, and it really likes to have these nicotinic receptors stimulated. And so when you are vaping or smoking a combustible cigarette, you are drawing this into your lungs. It goes to the alveoli. From the alveoli, it goes, it's absorbed quickly. It goes to the left ventricle, then directly to the brain. And that whole cycle takes maybe 15, 20 seconds. And so when you inhale something like a cigarette or the vape, you will have an immediate rush to your brain of nicotine, and your brain loves that. And it really is, it creates a lot of pleasurable sensation, and people really who are addicted to nicotine really love the sensation that it gives. The challenge is that over time that you will recruit additional nicotinic receptors, and so you then have to create more of a supply of this to your brain, and that's where people who really get addicted can do it quickly, and they have a long time trying to get off of it, which is really quite challenging as well. So nicotine addiction is strong, it's powerful, and the challenge is it takes quite a while to get off of it. The biggest risk with e-cigarettes is that you can get addicted without really knowing you are addicted, especially with young kids, until you are already firmly grabbed by that addiction, so to speak. The Minnesota Department of Health has some opinion about nicotine in general. It is highly addictive. It harms brain development during adolescence, and what we mean by that is that it does, the adolescent brain is what we call plastic. It's moldable. You can create pathway changes by having something before you're 22 or 23 years of age. And so you are creating an addiction predisposition that will last literally the rest of that person's life, just because it's imprinted into their brain during their brain formation period. And then finally, it does all the same bad things to fetal health that you might see with standard cigarettes. It just, nicotine is not a good thing. It's a very vasoactive substance. It also influences fetal brain development, just like it does in kids and teenagers. And with all apologies, recognizing that I'm stepping a bit out of my element here when I'm starting talking about oral health, nicotine is, as it is in all parts of the body, a vasoconstrictor. So it does all the same bad things to the gums in oral health that standard combustible cigarettes do. And as Annie was pointing out, you may not feel it as much, though, with the Juul especially. It's really kind of a stealth agent in terms of damage and harm it does to the oral health. It does decrease oxygen to the gums, and therefore gum disease is more likely. It does inhibit saliva production, and therefore you will have a buildup of bacteria as well as tooth decay. And then it seems in some people it does either cause or exacerbate the issue of grinding, oral grinding. Some of the specific health risks of vaping, as we know them right now, is that the harm from cigarettes really do have a really long latency period. So what we do know with cigarettes, and now that we're starting to know with vaping, is that it literally takes 20 to 30 years before we will know the full health risk of vaping. It takes that long for the body to show the true harm that is caused by vaping. E-cigarettes were developed in 2007, so we really only have like 10 to 12 years of experience with it. And it did take a little while for them to get to really get established and get used. So really, you're really talking 5 to 7 years of substantial use, and that's about all that we have in terms of data and how this is going to affect people in the long run. And then the other challenging thing in terms of research and knowing what the harm from e-cigarettes are, there's been a lot of variation in the amount of nicotine and other products in e-cigarettes. So we don't have great studies. We are getting more information, but it's going to be a while, like I say, before we really know the true full harm effects from e-cigarettes. As Annie was pointing out, there's a lot of additives that are put into e-cigarettes, and the challenge is a lot of the breakdown products of these flavorings and various vehicles that they add to e-cigarettes do cause direct harm to enamel as well as other oral structures. So, for example, propylene glycol is one of the things that give that big cloud of what appear to be vapor for people who are using it. Well, that can cause some direct toxic effects to both the enamel and soft tissues in the oral cavity. Propylene glycol also causes dry mouth, which then, as far as I understand, is associated with an increase in gum disease and other oral health issues. Another concern with some of the other additives to e-cigarettes, vegetable glycerin may not sound harmful, but it does cause problems with increased microbial adhesion to the enamel. It does increase biofilm formation, and then it can also have a direct effect on decreasing the hardness of enamel, which is not a good thing if you want to have good teeth, of course. There are going back to your basic organic chemistry, which I'm sure you all love to think about in retrospect, but when you extract things out of tobacco, you don't just extract nicotine. So it's impossible to get, if you will, a pharmaceutical-grade nicotine that you extract directly from tobacco leaves, but that's where the source of nicotine is for e-cigarettes. Well, you extract all those other bad chemicals from tobaccos as well. So one of the chemicals, NNN, that we abbreviate here, it does cause both oral and esophageal cancers, and that has been detected in the saliva of vapors. So we do know that people will get exposed to some of the very bad things that are in tobacco, normally thought of just with combustible cigarettes, but also very much in e-cigarettes as well. And then you have all the other bad things that whenever you're inhaling something directly into the lungs, you are circumventing a lot of the normal protective defenses that our lungs have. So you will have a direct irritant effect. So people cough, wheezing, pneumonia. If they have asthma, it's going to be worse. It will have a direct impact on the normal protective cells in the respiratory tract. You are circumventing all those, like I say, and actually causing harm. You then are inhaling all the carcinogens and heavy metals and volatile organic compounds, all of which are not good for your lungs when you think about it. And then when you start thinking about it, not only are you having a direct impact on the pulmonary system, but you are directly affecting the circulatory system, because you do cause problems with inflammatory processes that go on in the circulatory system, which does cause problems with vascular disease as well. Again, things that if you were thinking about it, you wouldn't want to necessarily do to your body. Just some of the thoughts. So we have this issue. We have a significant health issue that unfortunately will not have immediate direct effects on your patients and people coming into your clinics. And so how do we get out in front of this before it causes a lot of problems to their health, which it will have in the long run? So one of the things that we do know is that vaping is not seen as a way to do tobacco cessation. I think if you've noticed on the Juul advertisements, for example, they talk about make the switch. It's talk about switching from combustible cigarettes to Juul for all the wonderful reasons that Juul will tell you about why they want to make the switch to their product. So one of the things that you can do is you can definitely ask them directly about vaping as you would with cigarette use. And so, you do have to use the right language, because a lot of people will not recognize e-cigarettes as a tobacco compound, first of all. They will not recognize it's a harm to their health. But it's one of the things that you as a health professional can really take a step forward and really help them understand that this e-cigarette use, their vaping, is not healthy for them. It does it does cause problems with nicotine addiction. It does cause all the other health problems that we've pointed out up till now. And one of the things that you will really want to help them do is work towards eliminating any sort of e-cigarette use, as you would want them to not use combustible cigarettes or cigars or hookah or anything else as well. One of the standard formats that talks about tobacco use and helping your patients know about tobacco use is to, first of all, you ask if they are using tobacco products, and this includes e-cigarettes, and then you have to say vaping, Juul, any other set of synonyms that people use for vaping these days. And then you would advise them to quit. And this is where you can use some motivational interviewing techniques, because you really say, what's important for you in helping to stop your e-cigarette or your tobacco use? And then finally, you'd want to assist them with counseling, and this is literally maybe a 30 to 60 second counseling episode, and then some nicotine replacement products that can be used as well. And so when you ask, do you vape, do you Juul, do you use this with standard cigarettes, do you use the little cigarettos, do you use hookah, just really you have to kind of expand the vocabulary in terms of what you're asking about. And then you can advise them to quit. And there's another webinar which is available for people to view, and it talks about core motivational interviewing skills for helping people to quit smoking. It's something that was produced by, in conjunction with the Dental Association, by the Twin Cities Medical Society, and it's really something that I would encourage you to take a look at. And then assisting people to really stop their nicotine use is important, because it is a true addiction, and that addiction oftentimes is really cemented in pretty firmly into their brain, and so you do have to help them with this. And so a combination of counseling, which doesn't have to be long sessions, but then some sort of nicotine replacement therapy and or other medications is most likely to lead to success for them. Now, the success may not happen the first time, it may not happen the 10th time, it may take 20 times of trying to quit before people are successful in actually quitting their nicotine use. There are some FDA-approved medications. We don't recommend the use of e-cigarettes or Juuls to stop, because we really don't have a good way to do that and to recommend that officially. And so there's the gum, there's the patch in terms of nicotine replacement. There is also a prescription for a nicotine inhaler as well as a nicotine nasal spray. And then there's also things like Wellbutrin, also known as Zyban, as well as Chantix, that you can help people get on, or refer to their physician for prescription for those two products if you are not comfortable with doing it yourself.
So in Minnesota, we also have this great resource called Quit Plan, which hopefully you've heard of. This is the one place that you can refer all of your patients that are Minnesotans, live here, and that Quit Plan will either provide services, free services for those who are on state programs who don't have cessation services offered through their insurance plan, or if they do have those cessation services through their insurance, once they get to Quit Plan, they'll screen them and do a warm transfer, hand them right off to a counselor with their insurance plan. So it's a great resource and way for you to have one place you send all of your patients, and that they can kind of do that legwork for you. And then another new resource that you might want to consider is a texting program called This Is Quitting. So as we see this huge boom in young people, youth and young adults vaping, we're starting to think about what are tools that are really helpful specifically for them. And that we know that texting programs like this can be really helpful in addition to other counseling and support in helping young people quit. So if you go to the This Is Quitting website, they've got a number right there people can text. And they also have support for parents who are working with the young person in their life to get them to quit smoking. So it's a great program for young folks. So we appreciate you so much taking the time to watch us today. We hope that you feel more confident now talking about vaping with your patients. We know that as a dental professional, you have a great opportunity to be another part of this fight against vaping, to be another place where people can get this important information and counseling. So we hope that this was useful to you. We are always available for questions. So our information is here. Dr. Donnell and I both love hearing from you, and we love getting to help people think about how to implement this in your clinic. So please don't hesitate to reach out with us with questions. And if this is a presentation you'd like to have in person at your clinic, we can also do that. So please feel free to get in touch with us and look on our website for some great resources as well. Thank you so much.